Great. Well, welcome and good morning, everyone. Today I'd like to talk a little bit about vaccine health disparities. I know you guys know a lot about them, and you had a good lecture by Dr. Torres this morning about vaccines, but I wanted to go a little bit into the epidemiology side to provide some context of why we're always asking if people are up to date for vaccines. So I wanted to talk about a few things this morning. One, what about the current outbreaks? We hear a lot about outbreaks of measles and flus, and what is the true context of that? What are the current vaccine controversies? What are our patients saying about problems with vaccines, and how can we educate our patients better in order for them to receive vaccines and protect their health and the health of others in the community? Third, I'd like to talk about classic presentations of vaccine-preventable diseases. We don't see these as much anymore, and I want you guys to be able to identify them visually. And for current disparities of influenza vaccination, specifically using influenza as a case study in terms of different populations that are more or less amenable to vaccinations and other kinds of populations. And 5, future directions in vaccine care. So this is a very interesting article, just kind of scanning the Huffington Post one day, and you see there's a measles outbreak, and gave this to a group of students at the School of Public Health, and I asked them to pick out a couple of things that kind of were interesting to them. And some of them came back and said, oh my goodness, it's April 2014, this is very recent. Yes, it is. This is actually kind of a new phenomenon that we're seeing in California. The other thing that came back was, it was actually declared eradicated in the United States. So here we have measles. It was declared eradicated. People were very appropriately happy about that. And why is it making such a comeback? Well, we noticed that there are people who are becoming very comfortable with the idea of measles not being circulated in the community anymore. And so there are actually new phenomenon of something called anti-vaccination clusters or anti-vaccination campaigns where people are saying, I don't see measles. Why do we have to bother? So this is what we're seeing in California, and the concern is that this is spreading more rapidly in the United States. And if you can see, it rose 20%, so exemptions are filed now to actually be exempt from immunization. Just it's very scary, I think, in terms of the public health implications of infectious diseases. Wanted to bring also a 15% increase across the state of California. So also very alarming, and California seems to be the most significant currently for this. Also, just why is this happening? Whooping cough is also on the rise, also in California for similar reasons. And then you can imagine the concept of herd immunity. Well, only what happens few as 5% to 10% for pertussis. So we're seeing very low threshold for error, if you will, in terms of when your population is not vaccinated, it can really spread like wildfire. So we actually had a recent pertussis outbreak in Hillsborough County for this reason. We'll go into that a little bit later. Not because people weren't vaccinating, but people didn't have access to vaccines, and a lot of people were not able to mount immunity to the vaccine. So I wanted to talk about specifically high socioeconomic groups, and also this is something you've probably heard before or read. Vaccines, basically people have a misperceived risk-benefit analysis, right? As public health and infectious disease docs, we say you need a vaccine to prevent a disease. In some people's mind, they don't realize exactly what the disease can do, and to them it's a lot easier to treat symptomatically, which they think they could do, versus the blown out of proportion adverse reactions to vaccines. So just being aware that a lot of people have a kind of misperception of risk-benefit analysis for vaccines. I wanted to share this. Pertussis, Florida had 729 cases in 2013, and compared to all the other states, was very high. Granted, we have the third highest population, but still probably higher than we need to be. Ohio also had a lot of cases. This is pertussis nationwide. We're really high, and it's increasing in the United States. There's a couple of reasons. Great article in the Clinical Infectious Diseases was saying, well, the vaccine is not absolutely effective. That's true. There's decreasing and waning immunity. That's also true. But we also see decreasing rates of vaccination for a variety of reasons, so something to be aware of. I wanted to show you this as well. This is nationally what's happening with pertussis. And we're actually seeing, it's interesting, it says California. I'm not quite sure if that's accurate anymore, but I think the other states, safely to say, are increasing. So I just wanted to show pertussis clinical pictures. These are peds, and these are usually internal medicine board questions more than anything, but you'll see the raccoon eyes. When people are coughing so much, they actually, unfortunately, burst the blood vessels in their eyes. So unfortunately, little guy had pertussis as well. And usually, anybody know the number one kind of vector for infantile pertussis? How do they get it, mostly? From well-loving grandparents who have waning immunity, and for whatever reason they're not up to date. Their doctor may forget to ask them, or they're not able to mount immunity. So yeah, grandparents are actually the number one cause of infantile pertussis for the folks who are too young to be vaccinated. And for women, as you know, pertussis for that reason is indicated in the 3rd trimester of pregnancy to protect the infant born. So Bordetella, pertussis, whooping cough. I know you guys know this backwards and forwards, but I wanted to kind of stress the point when someone is hesitant to get their Tdap vaccine that not only does it cause a runny nose, low-grade fever, but it actually can cause vomiting, can actually cause death. It can pretty bad, and in China it's known as the 100-day cough because it's sometimes a persistent cough that won't go away. And apnea especially is life-threatening in infants. And adults are usually the vectors for that, especially older adults. Measles, I know you guys have seen this in books, but I wanted to point this out. I actually did see a case of measles in Maryland about 3 years ago for folks coming to the country who haven't had boosters or maybe have never been immunized. This would be important to keep on your radar screen. It was actually an adult woman. She's about 35, and she had actually exposed a lot of people in the hospital for measles before it was found out that that's what it was. These are your famous Koplik spots and your rash formation. I wanted just to throw out the name rubella. I know you guys know this, but a lot of your patients will get confused between rubella and rubeola. I just want you guys to make sure that you have that down so you can explain it. Also, German measles is another thing you might hear. It's actually rubella virus, and it is covered in the MMR vaccine. And roseola is the roseola infantum, right? General symptoms caused by a variety of viruses, so it's kind of a syndrome of herpes 6 and 7, herpes virus 6 and 7. And no vaccine is available for these viruses. Just going on for this, I mean, this is a lot of information, but just for those patients of yours who may not want to have the MMR vaccine, remind them that measles can actually progress to brain swelling encephalitis and can cause permanent damage. So when people are worried about vaccines causing damage, you can remind them, yes, measles actually does cause probably more severe, actually, brain damage because we don't see any evidence that vaccines are causing long-term neurological sequelae. Guillain-Barré, but nothing as severe as the measles encephalitis, clearly. And pertussis can also cause pneumonia, not just a bad cough. So just good to remember. I'm putting this up here because even though we're in adult ID, sometimes I think we get a lot of questions about pediatric vaccines, and there's a lot of questions and confusions. You can see this schedule here. Anybody heard of the, quote, alternative schedule out there developed by, I think, an alternative vaccine schedule, okay, endorsed by, I think, a cardiac thoracic surgeon of all people. Right, so we like to call it the experimental version because this is really the only evidence-based version that we have, and a lot of people are coming up with delayed or, quote, alternative vaccination schedules, and it's a little bit problematic because everyone is kind of following their own guidelines. There's a couple of recommendations in the popular press, but parents should know that there's really nothing evidence-based about them. It's a movement to try to prevent vaccine-related side effects, but just be aware that this is really the recommended guidelines. I wanted to go over briefly the adult immunization schedule. I know you guys are familiar with this, but just in terms of boards, I just wanted to show a couple of things that might be very important. So one, remember the Prevnar, the PCV13 versus the Pneumovax, which has the 23 serotypes. For general folks, we really like to give one dose greater than 65. Obviously, we work a lot with immunocompromised populations. This is what I wanted to show you. So in immunocompromised populations, the new recommendations are PCV13 first, including our HIV positive populations, and then about 8 weeks later, the 23-valent formulation. And that's kind of new recommendations, specifically people with HIV and immunocompromising conditions. Some folks in our clinic I know may not come back in 8 weeks and get the recommended vaccine, so to your discretion in terms of when your window of opportunity is, but just remembering that. Also, the 3 contraindicated vaccines, something to know, especially for pregnancy. Varicella, zoster, and MMR contraindicated in pregnancy, and HIV less than 200. So for your boards, remember, you need to know pregnancy less than 200, and then immunocompromising conditions are all kind of considered one in terms of vaccine-related health. So also important to know, meningitis, even though technically only recommended for people with asplenia or immunocompromising conditions, certainly recommended, I think, required for the Hajj in Saudi Arabia, and also, I think, recommended for college-age students as well. Some schools will recommend that and require that. Anybody know about the recent meningococcal vaccine, outbreak at Princeton? Yeah? Do you remember? Yeah, California, that's right. That's right. Anybody remember why that was kind of unusual? Serotype B, right? Right, which is not contained in the normal meningococcal vaccine. So I think it's available in Canada, but we're trying to get it more available here. It was given in limited quantities, right? So I wanted to also run this by you because I think as ID physicians, we think, yes, absolutely, yearly flu. We need to get that to people, and our patients sometimes refuse it. But just to kind of bring up that this is also very recent, and we're still having outbreaks. This is January 2014, and fortunately, we routinely have, especially women who are pregnant, actually dying from the flu. And so I just wanted to kind of bring that to your attention in terms of sometimes we get very comfortable with the flu vaccine and giving it out, but we have to really make sure to reach out to folks who might be more at risk, especially if some of our patients are pregnant or expect to be pregnant. And this is also, of course, the H1N1, which is the colloquial term swine flu, so also important to remember. I wanted to go over this briefly to give you an idea of health disparities with influenza. Anybody know the highest incidence of, which group has the highest incidence of infections during flu epidemics? Which age group? It's usually children, which was a surprise to me. I thought it would be either pregnant women or older adults, but this is what they're saying with this National Immunization Survey. And highest hospitalizations, as expected, older adults and younger children, and especially those with medical conditions. So the difference between infection versus hospitalizations. Average vaccination rate countrywide, about 40%. Yeah, that low. And yeah, we're pretty low. And average influenza vaccination rate for adults, greater than 65, a little better, right? Because we try to get our older folks for flu, and Walgreens and different CVS, Publix, et cetera, try to promote that a little bit as well in the community. So we're getting a little better, but still very low. So I wanted to share these statistics with you, and the reason why I'm doing this is kind of from a health policy ID point of view. I thought it would be interesting. So what this study did was actually comparing 2009 to 10 vaccination rates versus 2010 to 2011 vaccination rates. And you're seeing that, I'll show you a couple of things that really came to mind. We're starting with a very low kind of vaccination rate, about 41% and 43%. And then you'll see, I highlighted it, we're seeing a little bit increase in the less than 6 months, but we're seeing actually a very good difference of 7 here. It's hard to show you, but 7.3% for total. And I've done this too between specific groups. So you're seeing for African Americans actually increase of 5.3% from 33.7 to 39, an increase in Hispanic groups by 6.4% for greater than 6 months, and 6 months to 17 years. Very impressive increase in African Americans getting vaccinated from 37 to 50.8%. So I wanted to show that and try to think in your mind why we're seeing such increases over these 2 flu seasons. Again, we're seeing another comparison. Hispanics 18 to 49 showed a very good increase, and also African American populations actually showed a little bit of a decrease of 1.9%. The most sustained increase, greater than 65 years, was 10.7%, with African Americans kind of steady right there. So you're seeing different demographics are having different vaccine uptakes for a variety of reasons. So I wanted to kind of throw it out there. Why do you think we've seen really good success? I'll give you the highest one. Maybe in here, 6 months to 17 years, what could be a policy change that would kind of increase vaccine uptake for folks for flu? There's something called the Vaccine for Children program, which was implemented. So, and that's active in Hillsborough County. So we're able to offer basic actually a wide variety of vaccines, including the HPV vaccine now for children all the way up to 18 years of age. And then Hillsborough has a waiver to cover children 19 to 26 years of age for HPV as well, and also Hep B. So we're seeing a policy implementation change and a concentrated effort to get out publicity to increase vaccinations. So I guess we see vaccination disparities can be age-related. You're seeing children being kind of the focus of vaccinations, and getting funding for that is a little bit easier currently. But also social determinants of health can be modified. So knowing the statistics are helpful for public health implementation. And I wanted to talk a little about counter false information about vaccinations. I don't know if anybody wants to share common things that their patients have asked or said when you've offered vaccines. Do you see a trend? Okay. 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 So a time factor. Okay. Oh. So many. Sure. Sure. So there's a lot of misinformation out there. Absolutely. But I guess the reason I wanted to bring this up is couple of things, not only to let people know about the VFC program, but there's also Voices for Vaccines. There's a lot of pro-vaccine groups, and there's also started here at the College of Public Health the Vaccine Link project, which is trying to take the information on a factual basis to intelligently discuss and scientifically discuss the concerns for vaccines, whether it be mercury or autism or side effects, et cetera. So we're hoping to give people a kind of neutral scientific forum to talk about and understand a little bit more why vaccines are important from a public health perspective, and to give them a little bit more easily digestible information what the side effects of vaccines are, which are usually minimal, versus the great public health benefits.